I'm so thankful to be here every day. It feels like I have a new chance at life. I'm Maria Brayman. I went into medical school originally thinking I'd be a surgeon and ended up in pathology when I also knew that my biggest passion in life was to be a mom, and realized that the hours that it would take for me to dedicate to surgery would really take away from my ability to also be a mother. So I ended up deciding the closest thing to getting me into the operating room, or sort of close to dealing with bodies, was doing pathology. And so I did that, but it offered me, the opportunity to be home most evening with my kids. And I ended up at University of Michigan specializing in breast pathology, specifically breast cancer. And when I left my fellowship there, I went to Montana. It truly was amazing to be out there and at the foot of the Rockies in Helena, Montana. It was beautiful. And we lived in a new community that was on the edge of a ranch. There are ranches in Montana, not farms. And it had huge bales of hay. And it turns out in those bales of hay, it grows a mold that can end up in a small percentage of people, resulting in lung problems, which I ended up with was pulmonary fibrosis as a result of that. So that's really what started me off on this, the unfortunate part of the journey, where I ended up with lung disease that led to me getting the transplant. When I was in Montana, there really was not a lot of options there to help with treatment for that condition. So I actually I was at Mayo in Rochester, Minnesota, which was a 2-hour flight from Helena, Montana. And that's where I went to receive my treatment. When I moved here to Kentucky, I established care at University of Kentucky and was cared for by the pulmonology team for a while until I had a worsening of my condition. I had been to St. Lucia and came back with a cold, which felt like a normal cold, and it continued to progress, and my oxygen saturation just plummeted. I mean, when I went to stand up and just walk to the bathroom, my oxygen sats would go down to 70%. I ended up shortly after that on oxygen 24 hours a day, and then within a month or two after that, I was pretty much immobile. I was in a wheelchair, which led to me being evaluated by the transplant team. And then I was placed on the transplant list in November. It was incredibly fast. My bag wasn't even packed yet, because they tell you once you get on the list, have your bag packed, ready to go at any moment, and I wasn't even fully prepared. And in some ways that was good, right? Because I didn't have a lot of time to think about it and perseverate over it. It was a very quick turnaround time. And then they tell you to be prepared for what they call dry runs in transplant. So I was very prepared for that, to go in and for them to tell me at the last minute, this isn't going to work. And that's not what happened. But I remember waking up that Saturday, and I remember it very clearly because I still had the tube down my throat. But it was Saturday, which meant it was Notre Dame football day. So I had my pad, and I was like, Notre Dame football game. My kids tease me about it all the time, and they kept the piece of paper I wrote it on, because diehard Notre Dame football fan, and couldn't miss the game even though I was intubated. As I reflect on it, it was affecting me even more than I wanted to admit at the time. I was at the point where I was wheelchair bound. I mean, I really couldn't walk 10 steps without being in a wheelchair. With pulmonary fibrosis, oxygen barely helps. It doesn't really, you can't take a deep breath. It just barely helps you. And the cough, you'll hear a lot of people with that disease talk about the cough, and it's just horrendous. And my daughter showed me a video of me sitting on the stairs, it's like a whole body cough. At one point I actually broke a rib with coughing so hard. So it severely impacted my life. I couldn't walk. I didn't have the breath to walk. So being able to do that, I just am so grateful for every day. I'm grateful for my team, UK Healthcare, that works with me daily They are always a phone call away. So there was a lot that I recognized as a healthcare administrator that has been built into the quality framework and the very intentionality of how the staff interacts with patients at UK Healthcare. That's just phenomenal. And I just, there's a lot I took away that I could learn from that. and I was very impressed by. The other thing I'll tell you as a patient and as a physician that I was incredibly impressed by was the nursing staff in the intensive care unit, particularly the cardiovascular intensive care unit that I was in. It was very important for me to spend a lot of time researching where I was going to go for transplant, who the providers were, and to understand the team. Because with transplant, it's not just about the surgeon, and it's not just about your transplant pulmonologist. There's an entire team that cares for you, and that team is critical to the success of your care. Initially, my evaluation in care was at Mayo Clinic. I don't think that I could have gotten any better care anywhere in the world than I did with UK Healthcare. And I don't say that lightly. It was my life, and it's a lung transplant, which is the most complicated transplant that there is out there. So I was very confident in the surgeons and the doctor's ability to do the transplant, but the team is what made the difference for me. And the team is, beyond being knowledgeable and capable, this team is very caring, and they get to know you as an individual, and that's something that stands out. You know, you can go to a lot of other places in the world, but where someone, that old saying, where someone knows your name, where they know your family, where they know those individual things about you that make a difference, that can make all the difference in the world when you're dealing with something this complicated. There's no place better than UK Healthcare if you need a transplant. If you need a lung transplant, go to UK Healthcare. You don't need to leave the state. You don't need to go anyplace else. We have the best team, the best doctors right here.